What is and what causes macular degeneration?
Macular degeneration is a problem in the retina. So the term degeneration is pretty obvious. The macula refers to the part of the retina that's in the middle of your vision. And so when we're looking at the computer screen right now, and when we're looking at this studio, I'm looking at you, and I'm looking at you with my macula. In the periphery here, I'm seeing things. They're blurry, right? They're not as crystal clear as when I'm looking straight at you.
Right.
The macula is where all your cones are, right? If you remember from school, there's rods and cones. Cones are the very sensitive part of your vision, which are in the middle of your retina. And so that when I look over here, what I'm really doing is just moving my macula, if you think about it. I'm moving the most important part of my retina to be aimed at that clock or at your face or down at this microphone. The rods are part of our peripheral retina, responsible for our peripheral vision, and also responsible for color vision, movement vision, things like that. But the macula is where your cones are, and that's where your exquisitely sensitive vision is. And so macular degeneration is, to state the obvious, a degeneration of that part of your retina, specifically the cones or the very sensitive part of your vision. So sadly, patients with bad macular degeneration see very poorly on the eye chart, but have good peripheral vision, at least. And we talked earlier about glaucoma, which is the opposite, right? You lose your peripheral vision, you have tunnel vision, but you can still see the eye chart, you can still see someone's face.
Right.
But the loss of vision from glaucoma is also just as devastating because it's hard to walk around, et cetera. But the vision loss with macular degeneration is quite debilitating. Losing things like face is very hard to read with macular degeneration. It's a very tough disease. So how does it happen? You questioned, am I at risk for it, and how does it happen? The best thing to do, obviously, if you're concerned about macular degeneration, is to get an eye test. The doctor will dilate your pupils and look at your macula and be able to tell if you have it or not relatively easily just by looking at it. Macular degeneration is much more common in people like you and I who are more fair-skinned because it's a degeneration that builds up from free radical damage in your retina, which is often because of UV light exposure and smoking. And you and I have less pigment in our eyes, and so the UV light that we're exposed to is more damaging to someone's eyes who has more heavily pigmented eyes. So people who are Caucasian or fair-skinned, much more likely to get macular degeneration, and then people who are smokers, much more likely to get macular degeneration. The full term for macular degeneration is typically age-related macular degeneration. And you don't usually see, again, these caveats, right? Like everything that I say is not applicable for 100% of patients. But typically you don't see macular degeneration in patients who are younger than 65. Because it's not like you smoke one cigarette and get macular degeneration or have one exposure to UV light and get macular degeneration, but it's this slow buildup, this slow process that builds up in the macula. And it builds up in your entire retina and in your entire body, frankly, but in your entire retina, but specifically in the macula for reasons that have to do with perfusion. And those cells that we talked about, those cones that are so exquisitely sensitive and exquisitely able to focus fine detail, require a lot of metabolic demand. And so there's always oxygen coming in and replenishing that supply of cones. And so if you have any kind of problem that might decrease the perfusion or the blood flow to that area of your retina, that macula, it'll start to die. It'll start to degenerate. And that's what macular degeneration is. So the thing that I notice the most about macular degeneration is a patient will come in and say they're late 60s, right? And we'll start to see some signs of early macular degeneration. It's never too late to quit smoking. It's never too late to wear sunglasses when you go outside. It's never too late to be sensitive to these things. I think smokers and people who have poor diet, also at risk for macular degeneration, have heard it from a lot of doctors that smoking is bad for them. But I think it's never too late, and it's always necessary to keep reminding people who smoke about the risks to their vision and the risks to anything, right? I think a lot of patients who maybe are listening or watching this right now everyone knows that smoking is bad for them, but might not necessarily know that it's related to their eyes or could affect their eyes, and especially could cause macular degeneration. So smoking, certainly the number one modifiable risk factor for macular degeneration. So we'll see patients with macular degeneration. We'll recommend a certain type of vitamin that they can take to limit the macular degeneration, or at least limit the progression of macular degeneration. We'll talk to them about smoking cessation. We'll talk to them about eating right, typically like leafy green vegetables, more salads, less fried food, more salads. And then if the macular degeneration keeps progressing, there's certain medications that we can recommend to help it.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.